we have to ask people to be smarter. This issue of self-distancing isn't just about a good idea. It's absolutely the right thing to do. We are telling people, keep your distance. It is so critical in terms of saving lives. And why do we say this 2 meters difference? Because what that does is that if someone sneezes, which we say, if you have to uh, sneeze into your elbow, or if you cough and the spray associated with that, the impact of it is so dramatic. We can't stress enough how critical that is and how important that is. You save lives by doing this. Look, if you have to do your shopping, there's so many options. Can you pick and consider different times? Can you consider home delivery? Can you consider having a friend do it? It isn't a family outing anymore. This is something that we understand why people do it. But I can tell you this, when we look at what we did over the weekend, where we laid almost 2 dozen charges for people that were in skateboard parks or looking to play basketball or play on our recreational equipment, that's not allowed, not now. And there are reasons why that just makes sense and common sense. We're asking all Londoners to take that attitude and when I said yesterday, parents, teach your children well, we really mean that as well. Too many times we've seen teenagers coming together in little groups and arms over shoulders and sharing soft drinks and things. This is absolutely a recipe for disaster. And we can't stress enough that what you must do is self-distance. And we've limited it to crowds of five and groups of five. And we're asking people to look at different options that are out there. I mean, even tonight, the second point I was going to make is that council will practice what I'm preaching. And we will have no more than 5 people in total in our council meeting tonight. I will be the lone member of council there, and everyone will come in remotely. And we've made a change to our standing committees. So only the committee chair will be the person from council represented, and the rest of the committee members and other interested members of council will remotely connect in so that we can ensure that we have safety and that we lead by example. It starts tonight with us. And so we're asking you, please, to do the same thing. That is so important because you have the opportunity to save a life, and it may be your own. I'll turn over to Dr. Chris Mackie for his thoughts as well, please.
Dr. Mackie, you're on mute.
Of course there was, I knew that. Thank you very much, Mr. Mayor. I really appreciate your comments and in particular, the leadership that you and council are playing in implementing strong distancing measures in your workplace. I do want to comment as well on the Costco lineup. This is an image that went viral. I think it's useful to look closely at the image. What you've actually got is people taking shopping carts and using shopping carts to distance between themselves. This isn't ideal. Shopping carts are not 6 feet long, but it is better. It isn't quite exactly what the image portrays. That said, I could not support your message more, Mr. Mayor, that it is crucial that we all take physical distancing very seriously. We've actually asked a public health inspector to attend Costco today to make sure that best practices are being implemented there. Briefly, in terms of an update, locally 14 new cases today, bringing our total to 150. We did have a new death reported in the past 24 hours, so total of 6 deaths in our area. Across the province, 379 cases reported today. Not a particularly concerning figure, relatively low compared to some of the highs of the past week. The concerning figure from the Ontario data is the percentage positivity. Those 379 tests were positive on just over 2,000 tests, puts the percentage positivity of 14.8%, big jump from previous days. We've been averaging around 8 to 10% over the past week or so. What that means is, even though there are less tests being done in the community across the province of Ontario, we are seeing higher rates of illness. The coronavirus, COVID-19, is more present than it has been yet to date. Two issues I want to make sure that we talk about today. First of all, assessment centers. We have some high functioning, essentially drive-through assessment centers in the London area that are serving as resources for the whole region. Things are going very well at those assessment centers. And we actually have capacity now, both from the count and swabs and also the human resources to increase the testing at those assessment centers. What this means is that the criteria for tests at assessment centers at Carling Heights and at Oak Ridge Assessment Center at Oak Ridge Arena will be expanded so that people who have symptoms that could be coronavirus and also have underlying significant illness that might put them at higher risk, those folks will be tested. It is important that we keep getting tested. Case and contact tracing is a key public health strategy and has been part of the success in some countries that have been the most successful on controlling the spread of coronavirus. The second issue I want to make sure to discuss today is the issue of long-term care homes. We often think of the healthcare system as, hospitals and doctors' offices. Long-term care homes are a crucial part of the system. These are patients, many who are elderly, all of whom have significant medical illness, are being cared for in the long term. These sites, by definition, will have very high-risk patients. And we are starting to see cases in long-term care homes, now a total of 9 cases in long-term care homes across the Middlesex-London area, 6 homes in outbreak status now. This is a worrying development as we see the virus spread into areas where our most at-risk citizens are living. There are a number of strategies already in place, and we're working with long-term care homes and others to figure out even better strategies to try and protect the people in these very high-risk situations. Some of the things that are already being done: cohorting of staff so that staff are not working at multiple facilities and potentially bringing infections from one place or another. Isolation of new admissions so that people coming, say, from hospital or from the community into long-term care homes are isolated for 14 days, just as others would be if they had been returned from a country with higher coronavirus spread, or if they've been in contact with someone with coronavirus. Again, looking forward to continuing to work closely with long-term care leadership to make sure that we're doing everything possible to protect the individuals that are in very high-risk situations there. Thanks very much, and happy to take any questions.
All right. Thank you very much, Dr. Mackie. Thank you, Mayor Holder. We are going to get to the questions from the media, and I just want to point out we have about 19 minutes left in the briefing today. First question is from Saranjit Shigal at XFM at Fanshawe. It's a question for Dr. Mackie. There have been people with no symptoms at all and they've still tested positive for the virus. Does that mean the virus is being spread by those who don't even know they have it?
Yes, so it's a good question. There is what we call asymptomatic spread, so spread by people who don't have symptoms. At this point, it appears that those who do have symptoms are substantially more likely to spread the illness if they're in contact with others. And that's just because when you have symptoms, it's a sign that there is generally more virus in you. And we've had some of the cases in London that, our first case, for example, that was a student at Western University that ended up having very low virus levels and not infecting anyone else in the community. Also an individual that took all sorts of precautions as well. But we know that, yes, there is asymptomatic spread, and still probably 80–90% or more of spread is from people who have symptoms.
All right, thank you very much. And I also noticed at the bottom of that question, there was a question about the lineups at Costco, and the next question was from Steve Young at CTV, and I think we've already addressed the question of the lineups at Costco. Dan Brown at the London Free Press has a question for Mayor Holder related to those lineups at Costco. He is just wondering if you know whether anyone in the lineup this morning was fined.
Well, thank you, Dan, for the question. There's no bylaw in terms of self-distancing at this point. So one is not breaking the law in terms of being within 2 meters of each other. What they're doing is they are putting at risk their loved ones and the people that they're closest to and in contact with. We have not dismissed the idea of considering this as an option. We know other jurisdictions have done this. At this time, we've tried to do this through education, just as we have done over the last number of weeks. It is not a function of people not knowing. It's a function of people using common sense. But if the common sense approach isn't good enough, then frankly, we'll do what we have to do to help keep Londoners safe.
Thank you very much, Mayor Holder. Dr. Mackie, the next question is for you. Again, Dan Brown at the London Free Press. With COVID-19 cases confirmed at 7 long-term care homes, I think you mentioned it was the number, I think it was a little different. Are these facilities doing enough to combat the spread of the virus, and are there any additional measures you'd recommend they take?
So long-term care facilities are doing their best in a difficult situation. Some of the pressures include human resource pressures. Once you limit the number of places, many staff work in multiple long-term care. So now that we've limited that, that puts pressure on human resources in each of those settings. Next steps, I mean, looking out into what could happen going forward, you could see additional social distancing measures happening within long-term care. You could see additional personal protective equipment to help reduce spread in long-term care. These are the things that we're working closely with our partners to see if we can bring to fruition.
All right. Thank you very much, Dr. Mackie. I think we've got another question coming in. This is from Kelly Wong at 980 CFPL Global News Radio. And again, this is a question about the Costco situation. Is the health unit recommending the city to take further precautions to prevent situations like this? And I think Kelly may have joined us late. She may not have heard your comments earlier.
Yeah, so on the Costco situation, important to look closely at the picture, look at the camera angle. People do have shopping carts between themselves, which is, better than nothing, but it's not great. The Costco situation is something we're investigating. We have sent a public health inspector out to Costco to examine the situation and work with the management at Costco to make sure that if there's anything else that can be done, that is done.
I'd like to add to that too, if I can, for Kelly's benefit. I'm not sure what you heard. Look, it's really clear we're in unprecedented times now, and that may require unprecedented measures. We've taken a really thoughtful educational approach. I appreciate what the health unit has done in terms of providing strong guidance and direction in these times. We are saying to people, for your sake, for the sake of your families, for the sake of those around you, keep your distance.
All right. Thank you very much. Dr. Mackie, we've got a question from Sophia Rodriguez at CBC London. We have 25 cases which have been resolved. How does the health unit determine if a case has been resolved?
So resolved is something that we are tracking. I'm going to say reluctantly, to be honest. It's not a public health measure that is used in a standardized way, which means we can't really interpret that very well. When a case is resolved, there are two ways to become, quote, resolved. The first is to test negative. we do offer that test for people once they've recovered. And the other would be to pass a 14-day period. Now, for a healthcare provider, they still need to test negative. So we wouldn't consider that resolved in terms of allowing them to work again without a mask until they have tested negative. But for the general public, the risk of infecting others significantly drops off around that period. And so that's an alternate way to become counted in our recovered category for what it is.
Okay, great. Thank you, Dr. Mackie. We have another question from Saranjit Shigal at XFM at Fanshawe. Dr. Mackie, this is another question for you. Many people have been using gloves to protect themselves from the virus, but they touch their face and phones with the gloves on. What is your recommendation on that? What is your feeling on that behavior?
It's really not very helpful to wear gloves if you're going to continue touching your face and your phone, et cetera, et cetera, et cetera. The virus does not, penetrate in through your fingernails. This is something that's acquired through your mucous membranes of your face, your nose, your mouth, potentially your eyes, although much less common, and in through your lungs. So the gloves, I mean, maybe you have some virus on your gloves and on your hands, and you're preventing other people from acquiring your virus that is on your hands. But once you've contaminated your gloves by touching your face or other objects, they're really not doing you any good.
Okay, thank you very much for that, Dr. Mackie. Just looking down to see if we have any other questions. There may be one here coming in. Just bear with me. Okay, I'll put out a last call for questions. It looks like we are done on the new questions. All right. Hang on a sec. We've got one here. I'm just trying to get it on the screen. One moment. The technology is wonderful, but it is taking a little bit of getting used to. So bear with me just for a moment. Okay. Yeah, I'm just.
Maybe just as you find the next question, Dan, on the technology question, we are looking for your feedback. How are we doing with this new process in terms of meeting your needs as our local media? You've been incredibly helpful partners in getting out all the messaging. So we want to make sure that this is meeting your needs. If you have suggestions of how to improve these daily briefings, please do send them to dan.flaherty@mlhu.on.ca. Thanks.
Thank you. And we do not have any other questions. So just a reminder, we'll give you an opportunity, Dr. Mackie, Mayor Holder, to have a last word. But just a reminder that we will be doing this again tomorrow at 2 p.m. And we will send out the link to the media from the health unit. So you'll have the new link for tomorrow. And again, thank you for your participation. I'll turn it over to Mayor Holder.
Thank you, Dan. And I'd like to underscore the comments from Dr. Mackie with respect to the media support in getting the messaging out. We can't do this alone. And we do need you to not only stay interested in this subject because we have not hit its peak as yet. And so, as Chris has indicated, this is so critically important that you help us get this message out in educating the public. One of the things that we have done is that we instituted our own email and call-in numbers so that we could take some pressure from the police on the 911 calls. And we get hundreds of calls every day from concerned citizens about individuals who are not self-distancing, crowds that are gathering inappropriately, businesses that shouldn't be open that are. We put in our bylaw enforcement individuals invoked a provincial statute and fined 2 businesses yesterday. About the almost 24 charges that were laid through our bylaw officials through our park system. And from our standpoint, we've had a lot of focus today on people just practicing good personal care. And we want to make sure that you share that information as well as a public with your own families so that we can keep Londoners safe and we don't have to report a new death or two at any given news conference. So please, Londoners, stay safe, stay smart, keep your distance. Thank you.
Dr. Mackie.
Thanks, Dan. I want to actually take a moment to thank the mayor again. It was your leadership that really got these off the ground, and also I observe every day that we do these how important it is to have your comments. And I got the technical side of things, but you've really done a great job of highlighting the things that our public most needs to hear in ways that are very approachable. So thank you very much, Mr. Mayor. Thank you all again for attending, and we'll see you tomorrow.